All right, so I'm going to walk into the room, provide hand hygiene. Hi, my name is Kelsey. I'm a nurse. Can I get your name and date of birth?
Savannah Taylor, 09/13/1994.
Awesome. I'm just going to check your wristband here. All right, I'm going to provide privacy and assure safety. And then I'm going to ask my patient on a pain scale of 0 to 10. Oh, actually, first, are you comfortable today in this setting?
Yes.
All right, perfect. On a pain scale of 0 to 10, 0 being no pain, 10 being the most pain, what's your pain level?
0.
All right, great. So now I'm just going to do the general assessment here. So what's your name?
Savannah Taylor.
All right, date of birth?
Today's the June 20th.
Yeah, sorry, the date. Location?
Hannah's house.
All right, and situation?
Here to do assessments.
All right, so our patient is alert and oriented ×4, and I already took her height and weight, and it is within the normal limits. Her posture looks erect and comfortable, and I don't see any obvious physical deformities. She has been very calm and cooperative with me today, and her facial expressions seem decently content. Her speech has been well articulated for her native language, which is English, and her personal hygiene is clean, and she looks well groomed. So I'm going to check her skin and nails. So her skin color is appropriate for her ethnicity, and I'm going to just check her skin by pulling my hands down her arms. Her skin was warm and it was equal bilaterally. It was dry and smooth, and I didn't see or feel any rash or lesions present on her skin. So now I'm going to assess for turgor by lifting her skin up right above her clavicle, and there is no tenting. So, yeah, she has no tenting. Her nail beds, like I said, they were pink. And I'm going to check for her capillary refill. All right, her capillary refill is less than 3 seconds, and her nails appear to be clean and smooth, and there is no sign of clubbing on her fingers. So now I'm going to do the part of the assessment with the eye. So her conjunctiva appears to be pink. Her cornea is clear and smooth, and her sclera is white, and her iris is the color of her eye, so green, and her eyes appear to be symmetrical on her face. So now I'm going to do the eye test, starting with the Perla test. So I'm going to check the size of pupil first. Her pupil size looks like it's about 5 millimeters. All right, so then you can just do this for me. All right, so it looks like her pupils are reactive to light. So now I'm going to check for accommodation. So if you could just look at my pen light, and then if you could look behind me. All right, so it looks like her eyes accommodated to the light, so she has a Perla of 5. So now I'm going to do the corneal reflex test bilaterally here. All right, so the corneal reflex was intact. So now I'm going to do the 6 cardinal fields of gaze test. All right, so that test shows that her cranial nerve 3, 4, and 6 are intact. So now I'm going to do her peripheral vision test to see if her cranial nerve number 2 is intact. So if you can just cover up the same eye as me and repeat the numbers I'm holding up back to me. 1, 3. All right, and switch hands. 2, 5. All right, so that did show that her cranial nerve 2 is working properly. So now I'm going to check her ears. They appear to be symmetric bilaterally. I don't see any drainage or anything behind them. The skin appears to be attacked in and around the ears. No drainage or discharge behind, and I'm not seeing any masses. Do you feel any tenderness when I touch your ears?
No.
All right, so no masses or tenderness. So now I'm going to perform the whisper test, which will determine if cranial number 8 is working properly.
Boy, cat, frog. Shoes, socks, gloves.
All right, so she repeated them perfectly. So her cranial nerve 8 is working effectively. So now I'm going to check her head, face, and nose here. So her face appears to be symmetric. So now I'm going to check her scalp by rubbing my hands through her hair. I don't feel any bumps, lesions, masses, no patches. So that shows that her head is normal cephalic. Now, can I just have you raise your eyebrows for me? Smile, frown, puff your cheeks. All right, so that shows that her cranial nerve 7 is working. Now I'm going to check for crepitus of the TMJ. So if you could just open your mouth, close your mouth, protrude your jaw. All right, so she has no signs of crepitus in her TMJ. So now I'm going to perform the sharp first light touch test here using this napkin and this fork. So Savannah, if you could put your hand out, this is what a sharp is going to feel like on your face, and this is what a light is going to feel like. So if you could just tell me which one and where when I poke.
Sharp and right cheek. Light and right forehead. Light and left forehead. Sharp and left cheek.
All right, so she did that perfectly. So that shows that her cranial nerve 5 is intact. So now I'm going to check her nose. Could you breathe out or blow out on the other nose? Just breathe. All right. So that shows that her nares are patent, and now I'm going to check or to palpate her sinuses. All right. Does that feel like anything to you?
No tender.
All right. So her sinuses are non-tender. So now I'm going to check her mouth and throat. So her lips appear to be pink with no cracking. Can I see your teeth? So her teeth appear to be white with no decay. And then if you could open your mouth for me. Your buccal mucosa is pink and moist with no lesions present. And I was checking her gums as well, and I didn't see any swelling or bleeding. And her tongue appeared to be pink with no lesions as well. So if I could have you stick out your tongue and say, ah. Perfect. So when she did that, her uveal retracted up, so it showed that her cranial nerve 9 and 10 are working properly. And then I'm just going to take another look one more time. All right. Could you stick your tongue out to the left and right, up and down? All right. So her cranial nerve 12 is working properly. And now I'm going to check her neck by trying to palpate the lymph nodes. This is the pre-auricle, post-auricle, auricle, occipital, and submandibular, and they were non-palpable. Did you feel any tenderness when I did that? Nope. All right, so they are non-palpable and not tender. And then I'm going to check your carotid here, and I'm going to do one at a time. All right, so your carotid is +2 bilaterally, and then if I could just have you move your neck forward and back, right, left. All right, and push up. Oh, and then push against my hand. All right, so that shows that her cranial nerve 11 is intact, and she has full range of motion, which is a +5. Now for the next part of the assessment, I'm going to move on to the upper extremities by taking her radial, cross your arms. All right, grab my hands. All right, perfect. And now push up on my hands, down on my hands. All right, so now I'm going to check her radial pulses. All right, so her muscle strength was a +5 and her pulses were +2, and I checked her respirations while I was doing that, and they were a 13. My patient doesn't appear to have any difficulty breathing, no distress. I'm gonna check for any lumps here on her chest. I don't feel any lumps. Did that hurt at all? No. All right. So no lumps and no tenderness on her chest. So now I'm going to auscultate her lungs here and just listen, make sure everything sounds good. All right, so the lungs sounds are clear with no adventitious breath sounds. So now I'm going to check the posterior side of the chest. So I'm just going to go back here. Her thorax and scapula look symmetrical. The symmetric expansion I'm going to check, so breathe in, breathe out. So her symmetric expansion is equally bilateral, and then her spinous process is a straight line, and there is no masses anywhere up here. Do you feel any tenderness?
Nope.
All right, so now I'm going to check for her kidneys. All right, so I don't feel any kidney tenderness or any masses back there. Now I'm going to check your lung sounds posteriorly. All right, so the lung sounds are clear with no adventitious breath sounds. Now if I could have you lay down, and I'm going to check your heart here. And I'm going to listen first with my diaphragm. All right, so the S1 and S2 sounds were heard, but I did not hear any sounds of the S3 or S4. So now I'm going to flip my stethoscope over and check for murmurs with the bell. All right, so I did not feel or hear any murmurs present using the bell of my stethoscope. So now I'm going to check the apical pulse and then see if it's palpable as well. So the apical pulse is present and regular, however, it is non-palpable, which is good. She's healthy, that's a good sign. All right, so yeah, regular rhythm, great, everything's good for that. Now I'm going to move on to the abdomen here. The abdomen appears to be flat, round, symmetric. I don't see any visible lesions or pulsations. Now I'm going to check the bowel sounds in all 4 quadrants to make sure they sound good. And I'm going...
Where do you start?
What?
Where do you like to start when you listen to bowel sounds?
I like to start with my bowel sounds on my lower right quadrant. Thanks for asking. All right, so her bowel sounds are normal active. So now I'm going to check for bruits. So I'm going to use the bell side of my stethoscope and auscultate in the same spots. I'm not going to auscultate in the same spot. I'm going to auscultate above the umbilicus. So I take that back. All right, so no bruits were present. So her bowel sounds were normal. There was tympany present in all 4 quadrants. So now I'm going to go on to percussion and then palpation, because for the abdomen, you always want to percuss before you palpate. All right, so percussion was good and it was tympany. Now I'm going to palpate. I'm going to start with light palpation and move to deep palpation. All right, so There was no tenderness or enlargement of the organs, so that's good. Now I'm going to move on to the last part of the assessment, which is her lower extremities. So her legs look symmetrical. I don't see any edema present. I'm going to check the posterior tibial. And then the dorsalis pedis. All right, and those sound good, so those are a +2, and now I'm going to test for her muscle strength. Push down, push up. All right, so her muscle strength was equal bilaterally, so 5+, so she's healthy.